Insomnia is a very common and frequent phenomenon. What is the definition of insomnia? Insomnia is a condition that occurs at least 3 days a week, with symptoms such as lethargy, drowsiness, irritability, difficulty concentrating, or physical discomfort during the daytime, which affects study or work. Acute insomnia lasts for less than a month, while chronic insomnia lasts for more than a month. Insomnia can be further categorized into 3 types. Difficulty falling asleep. It takes more than 30 minutes to fall asleep after going to bed. Waking up at night. Waking up for more than 30 minutes in the middle of the night. Premature awakening. Waking up earlier than expected, for more than 30 minutes, and not being able to fall back to sleep. Why does insomnia persist? Because insomnia is usually triggered by events, and as the impact of these events on you diminishes, sleep usually returns to normal. For example, if we are very nervous the night before an exam/interview and have difficulty sleeping, but after the exam/interview is over, our sleep usually returns to normal. However, if we have any of the above behaviors or thoughts that do not help us sleep, they may prevent us from sleeping and cause our insomnia to continue. Have you fallen into the vicious cycle of chronic insomnia? Many psychological papers have suggested that the reason why insomnia persists is that our behaviors, thoughts, body reactions, and emotions affect each other, forming a vicious cycle that keeps insomnia going or even makes it worse. For example, when you experience a stressful event in your life, e.g., a sudden physical problem, your stress level will increase, resulting in insomnia. At this time, if you start to have negative thoughts about sleep, such as repeatedly thinking about the negative consequences of insomnia, e.g., I'm going to have a terrible day at work tomorrow, this may trigger emotional and physiological reactions such as increased heart rate, muscle tension, etc. You may then change some behaviors. You may then change behaviors or habits, such as spending too much time in bed, drinking too much alcohol, or constantly checking the clock to see when you can sleep. These behaviors may inadvertently make your sleep worse, perpetuating or exacerbating your insomnia and causing you to have more negative thoughts about sleep, creating a vicious cycle. Do you know why insomnia persists? Is medication or non-medication more effective? Comparison of insomnia treatments. Common treatments for insomnia can be categorized into medication and non-medication. Medication. The most commonly known medications used to treat insomnia are sleeping pills, including benzodiazepines, esopiclone, and zolpidem, which have a calming effect on the nerves and are often used to help you fall asleep and stay asleep. Sleeping pills are more suitable for short-term use to relieve severe insomnia that interferes with normal life, but they do not really address the underlying factors that cause insomnia. In addition, although sleeping pills may have immediate effect, it is not recommended to take them for a long period of time to improve insomnia because long-term use may cause dependence and resistance to the drug, as well as experiencing different side effects. Therefore, sleeping pills should only be taken according to the instructions of a doctor after evaluation, and avoid self-adjustment or discontinuation of the medication after starting to take it, in order to avoid increasing the risk of side effects of sleeping pills. Non-pharmacological treatments. The most common non-pharmacological treatment is psychotherapy. According to the latest clinical guidelines of the American Academy of Sleep Medicine, cognitive behavioral therapy for insomnia, CBT, is the preferred non-pharmacological treatment for chronic insomnia. Cognitive behavioral therapy for insomnia is a non-pharmacological treatment of choice for the treatment of chronic insomnia. A number of studies have shown that psychotherapy is more effective than medication in improving insomnia. Most people experience a significant improvement in sleep quality after just 6 to 8 weeks of treatment, and nearly 80% of the people who have completed the treatment experience significant and long-term improvement in their insomnia. Appropriate nutritional supplements, meditation, breathing exercises, exercise, cooking, reading, and talking with friends and family all help to lower cortisol and maintain a positive mood, which in turn reduces insomnia. The Alice Sleep Method was created by Japanese manga artist Onodera-san. Through his manga works, he demonstrates this miraculous sleep method with his own protagonist, Alice, and this method has been labeled as the Alice sleep method by netizens. He emphasizes that as long as you follow the 6 steps below, you can fall asleep in less than 10 minutes. 1. Sit cross-legged on the bed and keep your body still. 2. Close your eyes and visualize yourself falling asleep, maintaining the same breathing rate as in sleep. 3. Stop thinking and do not think about anything for 1 minute. The author emphasizes that this step is the most important. This is the most important step. You have to empty your mind as much as possible at this time, but since the human brain will subconsciously produce images after 20 seconds, the author also understands that it is very difficult to think of nothing for 1 minute. If your mind is still blank, think of an image at random. 4. Focus on the image that just came into your mind and don't think of anything else. 5. If your mind suddenly comes back to you and you think, was I asleep? If your mind suddenly comes back to you and you think, was I asleep, then you can lie down and go to sleep. 6. Lie down and repeat steps 1 to 5 until you fall asleep. Later, some netizens asked the cartoonist why he didn't lie down on the bed in the beginning, thinking that lying down is better for keeping still. The cartoonist explained that when people lie down, they are very concerned about the condition of the pillows and blankets, and when they feel uncomfortable, their bodies will involuntarily turn around, which makes it more difficult for them to enter the state. He succeeded in never losing sleep in 10 years with the Alice sleep method. There are other non-pharmacological treatments such as progressive muscle relaxation, meditation, self-discipline training, physiological feedback, self-hypnosis, etc. Among these non-pharmacological treatments, muscle relaxation is the most recognized by clinicians, and it is also the most widely used technique in the United States. This muscle relaxation technique is so simple that it can even be practiced by recording. This method was designed by Jacobson in 1970, and it alternates between tightening and relaxing every muscle in the body, which slows down the pulse, lowers the blood pressure, reduces sweating, slows down breathing, lowers the activity of the cerebral cortex, and lowers the intrinsic stimulation of the nervous system to achieve the goal of relaxation of the body and mind. During the practice, all that is required is for the person concerned to sit or lie down in the most comfortable position, in a quiet environment, and naturally feel the sensation of relaxation and tension in the body. First, we divide the body muscles into 4 main areas. 1. The muscles of the palms, wrists, and arms. 2. The muscles of the head, face, throat, and shoulders, especially the head muscles, which are closely related to emotions. 3. Muscles of the chest, abdomen, and back. 4. Finally, the muscles of the thighs, buttocks, calves, and feet. When you begin to practice, you can close your eyes and practice tensing the muscles in these areas, and then slowly feel the feeling of relaxation. Do not overemphasize the performance of the exercise, it should be regarded as an exercise, as long as the practice twice a day, each time about 15 minutes, about 2 weeks, you will be able to familiarize yourself with the technique. As long as you are familiar with the practice, you will find that not a moment's work, you will be able to let the whole body completely relaxed. Beginners often question the effectiveness of this method and often give up, but many studies have shown that muscle relaxation training is helpful in improving insomnia, especially in those who have difficulty falling asleep, and those who wake up frequently during sleep, are very helpful. In addition, practicing mindfulness meditation can improve the quality of sleep, reduce the time it takes to fall asleep, and interruptions in night sleep is the most significant effect, but also applicable to different age groups, such as menopause or the elderly. Positive mindfulness is a state of non-judgmental focus on being aware of the present moment, with an openness to seeing things as they are. The state of mindfulness is a simple concept, and incorporating mindfulness into daily life practices like fitness and yoga has become a popular self-regulation strategy for managing stress, chronic illness, and improving overall quality of life. Meditation is a way to cultivate a state of mindfulness that involves breathing and concentration exercises, which have been shown to improve stress and anxiety, sleep quality, and more. Chronic insomniacs often suffer from sleep-related anxiety, worry about the coming night, and the stress of not being able to sleep. Everyone who has ever suffered from insomnia has experienced that the more you try to get to sleep, the less you can sleep. Sleep disorders occur when there is an imbalance between the mind and body, an imbalance between the day and night rhythms, and an overactivation of the sympathetic nerves, aka autonomic dysregulation. Positive thinking meditation may reduce the fight or flight stress response of the sympathetic nervous system by activating the parasympathetic nervous system. Positive thinking meditation, i.e., cultivating conscious awareness of the here and now, without attachment to the outcome, can help relieve physical and mental stress, and reducing excessive thoughts and emotional responses, stress and anxiety, in the brain can help us sleep better. By changing from an outcome-oriented approach, when to sleep, to a process-oriented approach, i.e., observing the state of mind-body interaction with the environment at this time, one can better understand one's own feelings and be able to get rid of these anxieties instead of getting stuck, and re-establishing sleep patterns. Exercising mental muscles through daily practice helps to better recognize and let go of the negative thoughts that lead to insomnia, so that the brain, body, and mind can settle down and get ready for sleep, thus improving sleep quality. Positive thinking meditation can be useful in the area of sleep disorders, which is why more and more people are using positive thinking meditation to improve their sleep. People who practice meditation subjectively experience better sleep quality, less daytime fatigue and less drowsiness. Even people with severe insomnia can benefit. Simply take 5 to 10 minutes out of your day to start practicing meditation, and in the long run you will be rewarded with a good night's sleep. A common way to relax and meditate before going to bed is to do a body scan, and the following are the specific steps to do so. 1. Lie in a comfortable position on your bed with your legs hip-width apart and your hands at your sides or on your abdomen. 2. Begin by paying attention to your breathing, paying as much attention as possible to the body movements associated with breathing, such as the rise and fall of your abdomen, or paying close attention to the air that comes in and out of your nose and mouth between breaths. 3. It's normal for other thoughts to come up, for our minds to rethink how the day went, or to get caught up in worrying about tomorrow. Recognize these thoughts as they arise and then, naturally, come back to your breathing, inhaling and exhaling. 4. Shift your attention to the sensations in your body, beginning with the physical sensations in your feet. You don't need to swing or move your feet, just notice their temperature or how your feet feel against the blanket or mattress, for example, how warm and soft the blanket feels on your body. 5. Turn your attention to your calves and notice how they feel. Then work your way up your calves, through your knees and into your thighs. If you feel any pressure or tension, try to relax your muscles. 6. Then shift your attention from your hips and pelvis to your abdomen. You may notice the sensation of your breath moving up and down, or other physical sensations, sometimes even emotional ones, perhaps tension or tightness is reflected in the stomach. 7. Move gently from the abdomen to the chest again, noting that each time the mind is drawn to a distracting thought, just gently and patiently guide it back again. 8. Move to your back and relax your muscles as much as possible, keeping your shoulders away from your ears. 9. Turn your attention to your hands and lower arms, again without moving your hands or changing anything, just observe and relax. 10. Then move from your neck into the muscles of your face, perhaps noticing any tension, and relax these muscles as gently as possible. Then pause for a moment to get a general sense of how the whole body feels. 11. Now, if you are still awake, return your attention to your breathing, and whenever your mind begins to wander, you can return your attention to the breaths and start counting them. Inhale 1, exhale, inhale 2, exhale, inhale 3, exhale. 12. If counting becomes a distraction, then focus on the sensation of the breath, feeling it enter or leave your body as much as possible, or the rise or fall of the abdomen and chest. 13. Now continue to count the breaths, and when you realize that you are distracted, just gently and patiently refocus your attention. It's okay if you forget how many times you've counted, just start again from 1. There are many practice audio files and apps available on the internet in various languages. Beginners can use the guides to help their practice go more smoothly, and try to find a way that is comfortable for them. What should I do if I fall asleep and wake up again? If your night sleep is interrupted at 2 o'clock or 3 a.m., you should not stay in bed because you will have negative associations with your bed and sleep, and the more you lie down, the more restless you will become. You can get out of bed and move around under dim lights, such as listening to relaxing music, reading books that are easy to read, and writing in your diary, etc., until you have a feeling of sleepiness and then lie down in bed again. Or try a simple abdominal breathing exercise. Through deep and long breaths, you can inhale oxygen, activate the vagus nerve, for the parasympathetic nervous system in the main nerve, help the body and mind to relax and calm down. The steps are as follows. 1. Sit or lie down comfortably with one hand on your abdomen and the other on your chest. 2. Inhale slowly through the nose, with the abdomen elevated. 3. Exhale more slowly through the nose, abdomen sinks. 4. Repeat this pattern 3 times or more as needed. In fact, everyone has their own sleep pattern. Sleep should be to feel at ease and relax and enjoy the moment, do not need to be entangled in the perfect sleep, according to their own work and rest and lifestyle habits to try to explore, to establish a set of their own sleep pattern. More observation of the body and mind and the environment interact with changes in the psychological calm, the body will naturally relax and rest.